Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode. This week brought to you by CariFree. Hey y'all, it's Michelle, and I'm excited to chat with you about one of the products that I have recommended to patients to help control their decay. One of the big conversations that I have with patients is all about pH. I am sure you know that the pH scale goes from 1 to 14, with 1 being the most acidic and 14 being the most alkaline. And of course, 7 being neutral like most water. We know that when pH in the mouth drops below 5.5, teeth begin to demineralize. And at a pH 5.5 and above, the teeth begin to remineralize. My patients are almost always aware of pH, like they've heard of it, right? And they find it interesting to learn about like how it affects their mouth and the health of their mouth and the rate at which they could have decay. So I often explain that many oral microorganisms require a pH close to neutrality for growth and are sensitive to extreme changes in acid or alkali. And the pH of most surfaces in the mouth is regulated by what we all know, saliva, which falls at about 6.75 to like 7.25. So optimal pH values for healthy bacterial growth will be provided to the areas of the mouth when it's bathed in saliva, right? We all know the values of good, healthy saliva. And we understand that a shift in the balance of bacteria in that dental plaque from healthy to unhealthy occurs from fluctuations in the environment. So when we eat, the pH in plaque can fall rapidly to below a pH of 5 through the production of acids, mostly lactic acid, as the bacteria then metabolizes the stuff that we just ingested. And then consuming acidic foods and drinks can likewise lower the pH within the mouth. And many of the healthy bacteria within dental plaque, the non-acidic producers, can tolerate brief conditions of moderately low pH, but are inhibited or killed by more frequent or prolonged exposures to acidic conditions. And of course, this is why we talk about form and frequency, right? Like if you're going to have the soda, drink it all at one time. If you're going to drink your coffee, try to drink it with a meal or in a span of a certain amount of time so that we're not doing it all throughout the day. Some advice that I could take from myself and every now and again too. So a healthy pH balance in the mouth can explain why we know many people who can consume lots of like sugary foods and drinks. They take less than ideal care of their mouth, but then they don't have any cavities. We have said for years, it's baffling. But it's really not, because at the same time, we know people who are extremely diligent about their diet and their home care. They do all the things that we ask them to do, but they continue to get cavities because the bacteria in their biofilm are primarily cavity-causing bacteria. And after explaining this, I shift the conversation to talk about pH neutralizing products like CariFree. And so I would love to tell you about 3 of their main products. The first being CTX Rinse. So it's designed to specifically control that oral environment and the factors in the environment that lead to cariogenic biofilm, that lead to that patient doing all the things they can do possible, but they still get cavities. This is going to help them control it. It has xylitol. It has 0.05% sodium fluoride. And it also has a patented pH positive technology to neutralize acidic oral pH. And of course, because it has fluoride, it has xylitol and a pH of 8, makes it a no-brainer for me to recommend to patients. There's also CTX4 Gel 5000. This is a low abrasive tooth gel that combines the anti-caries benefits of a 1.1% neutral sodium fluoride with this bioavailable nano hydroxyapatite crystallites. It combines it also with xylitol and CariFree's unique pH positive technology. So this toothpaste replacement is intended for all risk levels and ages 6 and above. But if you need it for the younger or ages, under 6, they have options in the CariFree line for those younger ages. And then there is the CTX4 treatment rinse. So there's CTX3 rinse, and then there's this CTX4 treatment rinse, which is really great for in-office use because it comes in a larger bottle. So it can then be used as your pre-procedure rinse. It has 0.2% sodium hypochlorite. It has a 10.5 pH and a 0.05% sodium fluoride and 3 grams of xylitol. So this would be your go-to for patients with a high Canberra assessment or just our overall high caries risk. Also, for patients with risk factors that lead to bacterial imbalances, targeted pH neutralizing dental products used daily can greatly support preventing a bacterial shift in their oral biofilm. This is especially important for individuals with unmodified risk factors like restricted diets. Maybe they're on a restricted diet. They can't do anything about that. Maybe they have salivary issues. They're on prescription medications that create xerostomia, or children at risk. It's preferable to prevent that bacterial shift, as we've been discussing, from healthy to unhealthy than it is to reverse an acidic biofilm back to healthy balance. I'm just going to say that again, just to make sure we are all on the same page with this. We would much rather prevent that shift in bacteria that goes from healthy to unhealthy than to then let it happen and have to reverse any damage done from an acidic biofilm attack. And if you want to know more about this and you have further questions, you can definitely check out CariFree.com. And guess what, friend? You can get a free copy of CariFree's book named Why Me and request a free webinar and samples. Who wouldn't love samples? By visiting CariFree.com/TIPisode. That's TIPisode. And I hope you enjoyed this TIPisode from me and my little takeover this week. Highly suggest you take a look at the CariFree product line. And if you have any questions, reach out. Thanks for listening to another TIPisode. And thank you to CariFree, who has pH elevated products that are proven to treat the bacterial imbalances in your mouth. You can learn more at CariFree.com. And hit that subscribe button on your favorite podcasting app. And follow us on Facebook and Instagram, and head over to ataleoftwohygienists.com and subscribe to our newsletter. We would love if you could rate and review the podcast. And thanks for listening to your unofficial dental hygiene podcast.